MAHSC is committed to ensuring that its research benefits patients. Our members deliver high-quality care, but the gap between what we know from research and what we do in clinical practice remains unacceptably wide. In MAHSC, we have taken the bold decision to train our leading academics in the emerging discipline of improvement science. This equips teams with the knowledge and skills required to change healthcare systems for the better. Improvement Science for Academics, or IS4Ac, is led by our team at Halo. We bring together teams to work on a healthcare improvement of their choice. Each year, our 6 domain leads put forward teams who will make a bigger difference in the implementation of their priorities.
I think what a fantastic idea to take people who are trained and educated to a really high level and then give them the gift of improvement science.
This year we have teams working on a range of projects, from medication safety to improvements in genetic testing for children with bilateral cataracts.
Over the last 2 years, we've put through almost 20 teams. We have actually been able to look at them coming in with a project and working with people who have expertise in improvement science to actually develop that project into a programme of work that they have then subsequently delivered.
Manchester academics deserve the best, and we use global leaders in improvement science to teach and to coach. One of our teams this year is from a large GP practice called Salford Health Matters.
I'm part of the Access Matters project with the IS4Ac, and I'm working with the Salford Health Matters GP practices and Salford CCG to improve access to our GP practices for our patients.
They took on the bold challenge to reduce hospital admissions by 50% by April 2015 and are well on their way to achieving this goal. They are working on a number of significant changes, such as changing the telephony and IT systems, giving receptionists standardised scripts which allow them to take important decisions rather than having patients wait. One of the most important features of their programme is that the way that they have listened to patients throughout and used their voice to inform the changes.
What matters really mostly to me is to be listened to.
Patients who need urgent attention get urgent attention.
The most important thing for me is that a patient who needs to be seen gets seen.
The team have used statistical process control charts to plot their improvement over time. They have learned through case review the reasons why their patients are going to hospital rather than coming into the practice, and are working hard to test innovative solutions. They test changes using the Model for Improvement, a simple framework which asks them to set an aim, test changes and measure the impact in iterative cycles. Tests are often small scale. One doctor on one day might change the order of their workflow to test its impact on waiting times. If successful, this will be tested again in different settings and ultimately by different doctors, who will feed back to the testing team so that tiny corrections can be made during each testing cycle.
We found the IS4Ac project great fun and really useful to be able to learn about how we make improvements to our systems. With the IS4Ac programme, we meet regularly with the team, which really helps us focus on what we're trying to achieve. The meetings with our advisors has helped us see the areas that we're weak in and where we can improve our efforts. We were able to realise that we were biting off more than we could chew, and we really needed to focus our efforts and focus our energies on those small changes that are going to have the most impact. And since having done that, we've really seen some gains in what we're trying to achieve.
IS4Ac provides important glue for MAHSC. It is one of the only places where academics, NHS professionals and improvement scientists come together from across members and across domains. The standards are high. To graduate, teams need to attend more than 80% of the face-to-face elements of the programme and complete a manuscript which describes their work. If you think you've got what it takes to make a difference, why don't you put yourself forward for next year's programme? For more information, please visit our website.